These are the most important things to look for when you think you might have torn something in your shoulder. I'm Dr. David Geier, orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I hope you feel, look, and perform your best regardless of age or injury. Shoulder injuries are really common, and they can be really difficult to diagnose. There's a lot of causes of shoulder pain, so it's very likely you might want to consider seeing a doctor who has experience treating shoulder injuries. And they can be really hard to diagnose on your own, hence seeing a doctor. But I want to share some signs of some specific shoulder injuries. Let's start with something really common or something commonly worried about, and that is a tear of the rotator cuff. The rotator cuff is a series of 4 muscles that surround your shoulder joint. They originate on the shoulder blade and they attach to the tendons as tendons to the upper arm. They stabilize the ball in the socket while the larger muscles move your arm up overhead or out away from your body. Some of the common symptoms of a rotator cuff injury is that your shoulder hurts when you try to lift something overhead, or you get a pain somewhat in the shoulder, but a lot of times it's more your upper arm. Sometimes you feel pain in the front of the shoulder when you're doing overhead activities like reaching to fix your hair or getting something out of a cabinet, lifting something heavy with one hand out away from your body. You might have a feeling of weakness when you're trying to raise your arm out to the side or behind your back. As a general rule, if you have shoulder pain and weakness with overhead activity or out away from your body, there's a good chance you've injured your rotator cuff. Now, pain deep within the shoulder, especially after a specific injury, could indicate a torn labrum. The shoulder joint basically is made up of bones, ligaments, muscles that allow you to move your arm in different directions. The labrum is a cartilage bumper along the center that stabilizes it. If you have pain deep in the shoulder joints, not getting better with rest and over-the-counter pain medications like ibuprofen or acetaminophen, Tylenol, could indicate there's an injury to that labrum, that ring of cartilage on the basically surrounding the socket. Especially when you're trying to lift something heavy, you may really notice that. Another worrisome symptom, you have a feeling that your shoulder's unstable or that it might pop out of place. If it feels really loose or feeling like it's trying to come out of socket, especially if it's after a specific injury, it can be a sign of shoulder instability. And for younger patients with recurrent shoulder dislocations or subluxations, rest, physical therapy are usually not enough, and surgery a lot of time is performed. Now, it can be difficult to know if you tore something in your shoulder. The best way to tell is by seeing a doctor or an orthopedic surgeon with experience treating shoulder injuries. They'll look at a lot of factors, the type of pain you're experiencing, and any prior injuries you've had. They will examine your shoulder, perform x-rays, and maybe order an MRI to figure out exactly what the cause of the symptoms are and plan treatment that gets you back to what you like to do as quickly as possible. I'd love to hear about your experience with your shoulder injury. Leave those in the comments below. Just know I can't offer you medical advice if you leave a question in the comments, but I do try to answer some of those questions in future videos. Also, I'd love it if you'd subscribe to my video channel, click the bell to be notified when I release a new video, and start any live streams, including my weekly Ask Dr. Geier live shows. Thank you so much for watching. I look forward to helping you feel, look, and perform better than ever.